Namaskar everyone. Welcome to the webinar by Association of Physiologists of Rajasthan chapter. And today I welcome the speaker, Dr. Tripat Singh, and he's graduated from Patiala MBBS, then his MD is from Vallabhbhai Patel Chest Institute, University of Delhi. He specializes in sleep medicine as an international sleep specialist and sleep technology as registered polysomnography technologist. He is also a director of Academy of Sleep Wake Science, which prepares doctors and technologists for various international certifications in the field of sleep medicine and sleep technology. He is a program director for India's first STAR program approved by American Board of Polysomnography Technologists for RPSGT and CCSH exams. He's a regular faculty for National Sleep Course and National Sleep Technology course in India. He is editor in newsletters and he has published 5 books on various aspects of sleep technology. He is associated editor of American Academy of Sleep Technology book, which is the considered to be must read in the sleep field of sleep technology. Welcome, Dr. Tripat, and hope you all of the all of the participants will enjoy the talk of Dr. Tripat on sleep, foundation of health. The floor is all yours, Dr. Tripat.
Thanks, Dr. Omlata, for that kind introduction. I'll just share my slides. Can you please confirm that my slides are visible?
Yes, your slides are visible.
Okay, so I can start, right? All right. So, good morning, everyone. I'm Dr. Tripat, and I will be discussing one very important concept which is very close to my heart, and I strongly believe in it. That is the sleep, which is the foundation of health. And I'm very happy that now there is something called life's essential uh, parameters which everyone should follow for a healthy life, like eat well, exercise, check your blood glucose, check your weight, check your lipids, check your blood pressure, do not smoke. So until 2022, it used to be seven. It used to be called Life's Essential 7. In 2022, American Heart Association took notice of the importance of sleep for good cardiovascular health, and this Life's Essential 7 has been updated now to Life's Essential 8. तो सोना आपके हार्ट के लिए essential है. It has been recognized by the professional bodies also now. Now, in my whole talk, मेरा core message जो होने वाला है, that is going to be that sleep well and sleep on time. If you forget everything, this is what you are supposed to practice this for yourself, and also for you have to advise your patients about this. And why I am saying this, I'll build up my case with the evidence at hand. Now, before I dwell into this topic, I want to ask yourself one important question, that do you use or you know someone who own a smartwatch and they track their 10,000 steps every day on most days? And you please ask yourself, why do you do that? And I think most of you in your subconscious immediate answer would have come is, oh, taking 10,000 steps is good for my heart. If this has happened to you just now, my dear friends, somebody has done an excellent work at marketing this message, that equated a simple human behavior equal to cardiovascular health. Science has been simplified to a core message which has been delivered to the public for executing it on a daily basis for good cardiovascular health. I love it the way it has been done. And my goal in today's talk will be to simplify the science and distill it down to sleeping well and sleeping on time so that I'm able to convince you that sleep is not a pillar of health, rather, it is the foundation of health on which all other pillars will be standing to provide you overall good health. To make up my case, let me begin with a small story. Our ancestors, millions of years ago, they lived in jungles, and the only source of light that they had was moonlight in the night. During daytime, they will go into the jungles to look for food, and wherever they will get food, they'll consume it because there were no storage facilities available to them millions of years back. As a result, what used to happen was they were exposed to sunlight for 12 hours during daytime and they were exposed to darkness for 12 hours in the night. As a result, this light entering through the eye, it used to reach our suprachiasmatic nucleus, a structure in the brain, and as a result, we developed strong rhythms in the body which were entrained by light dark cycle, and we call these as circadian rhythms. We know that our suprachiasmatic nucleus, it sends signals downwards और ये सारे बॉडी को बता देता है भाई अब दिन हो गया है तो heart accelerates, stomach and your intestine and other GIT parts get ready to receive food, liver is ready for digestion, muscles know they have to work so their blood supply will increase, adrenals will pump up adrenaline to get you ready for the day, and kidneys will start filtering your blood at a greater rate as compared to the night time. Now, what we used to think was that it is a one-way traffic from suprachiasmatic nucleus to all the peripheral organs. But now the concept has changed, and what we are clear is not only suprachiasmatic nucleus is telling about light and darkness to all the peripheral organs. In fact, every cell in your body, when I say every cell means name a system, take a cell of it, and it has got a clock in it. And these clocks in the peripheral organs, they're very sensitive to another entrainer, that is food. So why this information is important? Because our ancestors' suprachiasmatic nucleus was telling our peripheral organs कि भाई अब रात हो गई है, अब खाना नहीं आएगा, क्योंकि हमारे ancestors के पास storage facility नहीं थी. तो हमारा जो evolution हुआ है हमारे organs का और उसके clock genes का, वो यही समझते हैं कि रात को खाना नहीं आएगा. लेकिन पिछले कुछ 50-100 साल में what has happened is that 24/7 society has been created and food is available 24/7 with the storage facilities. And when suprachiasmatic nucleus is telling the peripheral organ that is darkness and they can settle down because food will not come, and if you pop up food at that time by ordering it in the middle of the night at 12 a.m. or 1 a.m., your peripheral organs will face a problem because they have down-regulated their machinery. Whereas once you pump the food into the system, this food has to be disposed of, and these organs are forced to work in a down-regulated state. And that is where the problem starts, creating a pathological state. Keep in mind this 12-hour darkness and 12 hours light. It has created rhythms in the body, and there are certain functions in the body which happen best at a certain time. Like your alertness is maximum at 10 a.m. Your reaction times are maximum at 3:30 p.m. The cardiovascular efficiency and muscle strength is maximum at 5 p.m. That is why many elite athletes, they train hard in the evening because they are at their maximum strength. And please keep in mind, ये सिर्फ possible हुआ है, ये rhythms बन पाई हैं because of 12 hours of darkness and 12 hours of light. अब क्या हुआ? I'll fast forward the history to couple of millions of years, and I'm coming to 10,000 years back. What one very important event happened 10,000 years back, and that event was discovery of fire. Discovery of fire made it possible for the mankind to have artificial light for the first time in the human history beyond the moonlight. इससे दो चीजें हुई, एक तो लाइट आ गई रात को, दूसरी they were able to cook food at night. These two major changes happened with the discovery of fire. अब फायर से जो लाइफस्टाइल चेंजेस आनी शुरू हुई उनको एक्सेलरेट किया एक और इम्पॉर्टेंट इवेंट ने which happened past in the past 200 years, and that was Thomas Edison coming up with this bulb which have changed our interior of the homes to look like this at night, and our cities are looking like this at night. And we do not have any more 12 hours of darkness in our life. We still have 12 hours of light, that is daylight. But 12 hours of darkness has been reduced to, I will say, maybe 8 or 10 hours of darkness, because 2 to 3 hours is eaten by these artificial lights that we are exposed to. Our ancestors, they were sleeping for 7 to 8 hours in a 12-hour dark period, whereas we are sleeping for 7 to 8 hours in 8 to 9 hour dark period. There is a huge physiological shift that has happened. Now, Thomas Edison created this 24/7 working society with lights available all the time. Thomas Edison can still be taken care of. We can switch off the lights. Okay. But then another gentleman came 15 years back, which again changed dramatically the human history. And he was Steve Jobs. He came up with this phone, and this phone ensured even if I switch off the lights at night, the lights are still there. The light coming out from these screens, entering our eyes, reaching the suprachiasmatic nucleus, and still giving the signal that light is present. And that is where the conflict starts. And why I am worried about this part is because studies have clearly shown that light at night in older age is associated with obesity, diabetes, and hypertension. Light at night was associated with greater prevalence of obesity, diabetes, and hypertension community dwelling older adults. And the risk is very high compared to no light at night. Not only this, we have got televisions in our room, and many times we leave them on. And some people, they leave their lights on while sleeping. And in this study, what it has been shown is exposure to indoor light at night and its relation to sleep health is detrimental. So if people leave the TV on in their rooms at night while sleeping, or they leave the lights on in the room while sleeping, they will have more insomnia symptoms. They will have difficulty falling asleep. They will have difficulty staying asleep. They will have short sleep plus insomnia symptoms. They will nap frequently during the daytime. They will have inconsistent sleep-wake time. Their sleep duration will be less than 7 hours. They'll accumulate sleep debt of more than 2 hours. What is this? I'll explain later. And they will have overall poor sleep scores. So light at night, we were never made, we've never evolved as human beings to be exposed to light at night. Now, some people say sleep is a mistake of evolution. I disagree to that, because if sleep was a mistake in evolution, evolution would not have retained it over millions of years, number one. Number two, sleep is present in every species that you can name on this earth. And if it was a mistake, it was not a useful phenomena, evolution would not have retained it in every species. I don't think it's a mistake of evolution at all. At night, we have two types of sleep. One is non-rapid eye movement sleep, that is stage, and it is divided into stage N1, N2, N3. And there is second type of sleep is rapid eye movement sleep. These two types of sleep we need to go through at night, because both these types of sleep, they are doing some important function for our body, and I will show you that what functions happen during sleep that do not happen during wakefulness. Next, I will go to consequences of sleep deprivation, and I will tell you what steps you need to take to go forward with this information. So let me show you what happens during sleep that does not happen during wakefulness. I'll discuss four things here. One is your cardiovascular health. To begin with that, please remember, during wakefulness, your sympathetic system activity is high. The moment you fall asleep, this is the sympathetic nervous system recording, and you can see high activity over here. The moment you fall asleep and you go in stage N2, your sympathetic activity have gone down. You go in stage N3, sympathetic activity further falls down. That means during sleep, sympathetic activity goes down and parasympathetic goes up. And when we go in REM, there are fluctuations of in between increases in the sympathetic activity. Overall, when we sleep in non-REM and REM, overall cardiovascular system function goes down. Different parameters go down. As a result, heart is able to recover metabolically. So it's a great chance for the heart to restore itself and be ready for next day activity. And if you do not sleep, sympathetic system activity will not go down, it will remain high. Heart will not get a chance to down regulate all its function. It will need to work at the same rate that it is working during wakefulness. So sleeping is important for our cardiovascular health. Second, toxic metabolite clearance from brain, it happens only during sleep. It does not happen during wakefulness. And there is a system called glymphatic system. It's a new system which was discovered in 2013. Okay. We till 2013 we used to think brain does not have a lymphatic system. The big question was, then how does the protein metabolites get cleared from the brain tissue without the lymphatics? So in 2013, this evidence came that there is a special system in brain called glymphatic system, which clears the toxic metabolites, the proteins, breakdown products, these tau proteins, amyloid proteins from the brain. And this glymphatic system, my dear friends, it works only during sleep. It is not active right now when we are awake. It will only become active once we sleep, and it will be maximally working when we are in stage N3 sleep. So if you sacrifice your sleep, if you are sacrificing your N3 sleep, your glymphatic system activity will be affected. The beta amyloids, tau proteins will start accumulating in the brain, and over a period of 10 to 20 years, you'll be predisposed to develop Alzheimer's disease if you do not correct your sleep patterns. If you want to learn more about this glymphatic system, I have prepared a webinar on this, almost 1 hour webinar, where I have put all together all the information regarding this system where students can learn. But keep in mind, this system does not work during wakefulness. It works only during sleep. And studies have shown that even one night of total sleep deprivation, it has impact on glymphatic system. It raises the CSF beta amyloid levels in healthy middle-aged men, even one night of sleep deprivation. And here society is depriving themselves of sleep chronically. The third thing that happens in sleep is it is good for your immune system function. Remember, our memory have got a process of encoding, consolidation, and recall. Similarly, your immune system also, where your memory T cells, memory B cells are formed, that process is called consolidation. This formation of memory B cells, memory T cells, my dear friends, it happens only during slow wave sleep. That is when you go to sleep, you enter non-rapid eye movement sleep, and you go in N3 sleep. Then only it consolidates the immune response to infection. That is your memory B cell and T cell formation and their movement into the circulation to help you fight the infections happens only during sleep. In COVID times, it was very clearly shown that shorter sleep duration on the 2 nights before the vaccination predicted fewer antibodies 1 and 4 months later. During COVID times, it was a recommendation given that anybody who's going for vaccination, please sleep well on the night of vaccination and at least 2 nights prior to the vaccination. The fourth thing that happens during sleep, which will not happen during your wakefulness, is memory consolidation. Like you know, memory have got three processes: encoding, consolidation, and recall. Encoding happens during wakefulness when your brain is flooded with acetylcholine. Okay, and consolidation, that is from the short term memory going into the long term. My dear friends, that this transfer of short term to long term memory do not happen during wakefulness. It happens only when you go to sleep, because once you go to slow wave sleep, that is your stage N3, this acetylcholine levels in the brain drops down, and that is the time when the waves starts appearing, like hippocampal ripples, thalamocortical spindles, neocortical slow oscillations. This interplay creates a state where the short-term memory from hippocampus is transferred to long-term memory in your association cortices. And this transfer, my dear friends, does not happen during wakefulness. Just imagine WhatsApp backup happens at 2 a.m. in the night, because WhatsApp know you will not be using your app at that time. So they've chosen a smart way of backing up the data. Already that your body is doing that. Your body knows you will not be using, no more new information will be coming in when you are sleeping. So that is the right time for shifting these important memories from short term to the long term. So all the backup here also is happening at night. If you deprive yourself of sleep after learning important lessons, memory consolidation will not happen and long term memories will not be formed. Not only sleep helps you to remember, sleep also helps you to forget. This is called sleep to forget, sleep to remember theory. And what it is, just imagine any event in your life when you were sad or happy. You will remember what made you sad or happy. Not only that, there is an emotional component also. You might have cried, your heart rate might have gone down, there was a sinking feeling, or you were elated and your heart rate had gone up. That emotional component is also there. So what happens when a memory is formed, not only factual memory goes into the store, your emotional memory also goes along with it. And you must have experienced any event in your life when it happens, sad or happy event, you are affected by the emotion at that time. But if you recall that event 6 months down the line or few months down the line, you remember what happened, but that emotional component is not as strong as it when it happened. And who is doing that? Who is taking away that emotional component? My dear friends, your REM sleep. What happens when every night you sleep, REM sleep so slowly starts taking out this emotional memory out and only leaves the factual memory over there, so that later on, few months down the line, if you recall the event, you will remember the factual details, but emotional reaction will not be as strong as you had when the event happened to you. So this subtraction of the emotional component from your main memory, it happens only during sleep. It does not happen during wakefulness. So if you're depriving yourself of sleep, you might be having this abnormal emotional reaction for a very long time. That is why a common saying is, you feel bad about something, sleep over it, because it helps you to forget the emotional component and only the factual component remains. And people feel better by having less emotional reactions after sleeping for a while. Another thing, please keep in mind, the muscle also plays a role in sleep regulation through clock genes. We used to think that only suprachiasmatic nucleus sends downward signals. But now we know that muscle has got clock genes, and muscles clock genes they also regulate sleep. That is why they say exercise keeps circadian system healthy and helps you to sleep better, because muscle through its clock genes is regulating the sleep as well. And if you deprive yourself of sleep, what will happen? Your neuromuscular junction structurally it is affected. There is depletion of the neurotransmitter acetylcholine and the overactivity of its degrading enzyme acetylcholine esterase at the neuromuscular junction. And there are altered synaptic ultrastructure like mitochondria, synaptic vesicles, synaptic proteins, basal lamina, junctional folds needed for neuromuscular transmission. They are altered with acute sleep deprivation. That means you will not have a healthy muscle. And as a result, your muscle function will be affected. That is going to impact your sleep as well. So, my dear friends, all this is happening only during sleep. So you cannot compromise on your sleep. And if you compromise on your sleep, you have consequences to bear. And those consequences are cardiovascular system. We know we have very strong data to show if you deprive yourself of sleep, it leads to hypertension. It can lead to diabetes. It can lead to increased morbidity and mortality. It increases appetite and weight gain. It affects pregnancy outcomes, fetal and mother outcomes both, and neuromuscular junction is affected, affecting uh, the function of the muscle. Sleep restriction increases activity in reward system network, increasing food seeking behavior. And this is a very interesting finding, I feel, because our ancestors, when they were awake, they were looking for food always, and this has gone into our genetic code. At night, they will hide somewhere to protect themselves from a predator, and food was not available to them. So it was very clear to our body system that if we are awake, we are looking for food. And in today's 24/7 society, when we are keeping ourselves awake at night when we should be sleeping, our body gets the message that we are looking for food. And that is shown by the science as well, that if we restrict the sleep and stay awake at night, and especially if you're sleeping less than 6.5 hours, our food seeking behavior, the functional MRI have shown that the areas that increase the food seeking behavior, like left ventral tegmental area and substantia nigra, the activity increases in those areas. So evolutionary biology is making sense in light of these scientific findings. Also keep in mind, longitudinal study have shown that misaligned timing of sleep increases the association of visceral adiposity with metabolic syndrome burden in adolescents. And what they have shown is, if our children are not sleeping well, in future they are going to develop metabolic syndrome. Not only this, insufficient sleep predicts poor weight loss maintenance after 1 year. Anybody who's trying to lose the weight, if they are not sleeping adequately, especially if they are sleeping for less than 6 hours, they will lose weight. But the moment they stop exercise, this lost weight will be regained very quickly. So weight loss maintenance is very poor if you are sleeping for less than 6 hours. So if you want to
Sorry,
retain the lost,
Dr. Tripat,
yes, please.
there's some network issue, I believe.
Where did you lose me? Where did you lose me? Am I audible? Dr. Nayak, am I audible? I can. Dr. Nayak, am I audible?
Yes, sir, you are audible. Audible.
Should I
Sir, please.
continue?
Yeah, please, please.
Okay, I'm starting. So if anybody of you are planning to lose weight, and your or any of your patients are on the plan to lose weight, along with losing weight and looking at your dietary control, you need to be sleeping for more than 6 hours. Otherwise, weight loss retention is very poor. Very soon you will regain the lost weight once you stop the exercise. Another important aspect is 24-hour sleep deprivation leads to decreased social interaction. Studies have very clearly shown if we deprive ourselves of sleep, we have decreased social activity, we have decreased motivation to engage in interpersonal interactions, and an increased desire to be alone. There is increased desire to be more physically distant from others. We become less trusting of other people. We show enhanced physiological reactivity in response to social stressors, and we blame others in a frustrating situation. And what has been shown is sleep restriction reduces social motivation and positive social emotions as well. Like people reported reduced motivation to seek out interactions with other people. They used fewer words focused on other people, social connections when reflecting on a generous act of another person. After reflecting on a generous act of another person, they reported less gratitude and feelings of interpersonal connectedness. And why these? So basically, overall, what we see is sleep deprivation decreases gratitude. And why this is worrying phenomena? Because gratitude feeling is very beneficial for social behavior because it decreases anxiety and depression. It increases the engagement in health promoting behavior, it strengthens the social bonds, it facilitates trust, it promotes empathy and compassion, and it increases perception of relationship closeness. So, by depriving ourselves of sleep, we are decreasing our gratitude behavior, which is going to affect our social behaviors. And we might no longer be human beings because the greatest strength of human being is our social behavior. And one behavior that is making us sleep deprived is this procrastination, bedtime procrastination behavior, which is defined as getting engaged with electronic devices at night and compromising on the sleep duration. Yes, it gives you enjoyment, autonomy, and stress relief, but it impacts your sleep by lowering its sleep quality, lowering the duration, and poorer daytime functioning. And why this is worrying phenomena, that is engaging with electronic devices used at night, because studies have shown that nighttime smartphone use frequency is associated with poor general health and healthcare utilization. And as a result, what happens is if we are engaging with these smart devices just before our sleep time and we are procrastinating the sleep, what is happening is we are sleeping less than required. And this is creating a condition called social jet lag. What is social jet lag? If it, I'll give you an example. If my body needs 8 hours of sleep and I sleep for 6 hours, I have created 2 hours of social jet lag for my body. I'm not talking about the jet lag that we get while flying from one country to another. I'm talking about the jet lag that our body suffers. So by sleeping less than required, I'm creating a social jet lag for my body. And who is contributing to it? One common behavior that has come out is nighttime electronic gadget use just before you sleep, where you spend time on these gadgets for a long time, eating into the time that you could have spent sleeping. And why I'm worried about this phenomena is this social jet lag. It affects smoking and drinking behaviors. It lowers academic performance. It lowers physical activity. It leads to higher BMI, predisposes to cardiovascular disease and depression, and it leads to metabolic syndrome and diabetes. Not only this, very clearly, we now know that social jet lag trajectories and body mass index have got a very strong relationship. Like in males, if somebody was having low social jet lag, that they were sleeping enough according to the body needs, but then suddenly they change their behavior, like bring in the bedtime procrastination, and their social jet lag starts increasing. From low social jet lag, they went into the increasing social jet lag. These people were more underweight or obese in males, and in females, from low to increasing or chronic jet lag, social jet lag led to females being more obese. So, my dear friends, not only this behavior, constant behavior, also this, if you today you are following healthy habit and you change your habits and decrease your total sleep time, that also is going to impact your future weight gain. And what we do to by doing the bedtime procrastination, what we are doing is we'll try to catch up on the sleep on the weekend. Okay, we'll try to sleep more on the weekends so that we can make up for the sleep that we have lost. And can we recover from this lost sleep by sleeping more on the weekends? My dear friend, answer is no. Catch up sleep is associated with depression, hyperlipidemia, poor glycemic control, hypertension, and poor life quality. And some people think, oh, I can sleep in polyphasic manner rather than in a monophasic manner than sleeping at night. And my dear friends, if you want to go in that direction, again, has been shown that polyphasic sleep cannot serve all functions of monophasic sleep. So you need to sleep in that monophasic at night to get all the physiological functions taken care of. This brings me to a very important question. At what time you need to sleep, what time you need to wake up. So this data have shown that people right time, they have taken the comparison between 10 p.m. to 12 a.m. and anybody who's going to bed after 12 a.m., they have higher association with all cause and cardiovascular disease mortality. Anybody who's waking up after 8 a.m. rather than between 6 a.m. and 8 a.m., they have higher association with all cause and cardiovascular mortality. And if your sleep midpoint is not between 2 to 4 a.m., rather it is beyond 4 a.m., then also you are having higher risk of all cause and cardiovascular disease mortality. So try to sleep between 10 p.m. to 12 a.m. Try to wake up between 6 a.m. to 8 a.m. and make sure your sleep midpoint, if you follow this advice, will fall between 2 to 4 a.m. Now, the important question that arises is, if I change my behaviors and start following the advice given to us for a healthy sleep, can I lower my future risk of cardiovascular disease? If I had bad habits in the past and I changed them to good habits, good sleeping habits, can I change the risk for cardiovascular disease? The good news is yes. So overall, optimizing sleep patterns and maintaining a healthy sleep pattern may reduce the risk for cardiovascular disease. So people who optimized or they were maintaining a healthy sleep pattern, they were able to lower their risk for cardiovascular disease. And another thing that has come out very clearly is the gut microbiome, which plays a very important role in our health. Sleep actually affects the gut microbiome. So if you have high night to night variability, your sleep latency is very long, or you are napping during day, your sleep quality is poor, or you have sleep apnea, all this contributes to poor gut microbiome affecting our sleep. And if you have poor sleep quality or you are depriving yourself of sleep, now the models have very clearly shown it predisposes to anxiety of different severity. So my dear friends, I hope so far I have been able to convince you that sleep cannot be ignored, because there are a lot of functions that are happening during sleep only, which will not happen during wakefulness. And you should be able to see why I'm saying sleep is the foundation of health. Now, if once we are convinced, where do we go from here? Why I'm bringing this topic in today's discussion is because if you look at the literature of past uh, 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 the studies, most of them have focused on sleep duration only. If you want to move from here and engage yourself in healthy sleep, you have to go beyond duration, and you will have to engage yourself in a concept of sleep health, which not only includes duration of sleep, it also includes regularity of sleep, satisfaction of sleep, alertness during daytime, timing of your sleep, and your sleep efficiency. All these have to be taken care of. It's not only duration that is important. So if you want to change your habits, you have to change your habits for duration, for regularity, and for timing. satisfaction, alertness, efficiency will automatically improve if you take care of the duration, regularity, and the timing of the sleep. Why this is important? Because if we are not taking care of these dimensions, it is predisposing to depression, health risk factors, chronic disorders, physical activity problems, cardiometabolic outcomes, weight loss issues, mortality, and total healthcare costs go up. And I have accumulated this data from a lot of cross-sectional studies and also longitudinal health outcomes. All these studies have clearly shown that if we do not care of these sleep health dimensions, we will be predisposed to a poor health. Not only general population is affected, even if special populations like athletes, they have insufficient sleep duration, they have poor sleep quality, they have fatigue and sleepiness, they have suboptimal sleep timing, they have irregular sleep schedules, and they sleep and they have circadian disorders. Their muscle strength and speed drops down. They have increased risk of injuries and concussion risk. Their reaction time and vigilance is affected. Their decision making and creativity is affected. Their learning and memory is affected, and their mental health is affected. And my dear friends, nowadays, elite athletes, they are paying a lot of attention to their sleep health. They are paying attention to all these components. And even to the extent that some countries like Japan, US, they have got sleep physicians to accompany their athletes when they go for Olympics. So sleep is the foundation of health, and achieving good health is an art. What is this art? Let me show you. Art is A for amount, regularity, and timing. And my dear friends, you have to attain this art for not only sleep, also for light dark exposure, also for eating, and also for physical activity to stay healthy and achieve a disease-free life. Now, as far as my focus today will be in the sleep part and the light dark part. How do we measure amount of sleep, regularity, and timing of sleep of our patients on a daily basis? This is where very important group of devices called consumer sleep technologies, they come in. Consumer sleep technologies are the smartwatches that we are wearing. So this study have highlighted that we can classify these consumer sleep technologies into three groups. Group 1, users who require highly accurate sleep staging performance in patient studies. They should use EEG-based wearables. This is a headband which used to be available commercially, but now you have to specifically contact this company to get this headband. This is a very highly accurate, gives good, highly accurate assessment of your sleep variables, your amount, your regularity, your timing. Group 2 is users assessing sleep longitudinally in persons without highly disordered sleep. This is your general population. And here the researchers have found that Aura Ring and Fitbit Flex, these are very accurate devices to tell you about the amount, regularity, and timing. And the least accurate are the group 3, which are very low price trackers, which only just gives you basic sleep period logging, but you cannot rely more than that on these trackers. If you are a researcher, you might like to use group 1 devices. If you want to advise your patients, you might like to advise the group 2 devices. And if you want to learn more about these consumer sleep technologies and what all information you need to know, you can just go to my website at this link. And if you go to this course, which is free of cost, you can listen to a webinar on consumer sleep technologies, which will give you the overall picture of what you are supposed to know about it. And my dear friends, it is possible to use these consumer sleep technologies to study sleep patterns in large populations. Like in this study, they used Aura Ring to capture the information of the users about their sleep patterns in these countries. And they captured weekday sleep timing, weekday total sleep time, sleep onset time, wake time, total sleep time, weekend sleep extension, social jet lag, all these could be calculated just by looking at the data from these consumer sleep technologies. And all this data was at population level. And one very interesting thing that came out was that in India, we are sleeping late, and we have the low one of the lowest total sleep times during weekdays, and we have a high social jet lag when compared to other countries. Asia performed very poorly on these parameters. And nowadays, what is happening is the more we tell our patients about sleep, they start going on YouTube and start looking for information about how to sleep well and why sleep is important. We should avoid doing that, and we need to create our own sources for patient education, because popular videos about sleep insomnia on YouTube featured misinformation and commercial bias. So as doctors, as clinical community, we need to create our own sources. And again, I will emphasize, this era of sleep duration is gone. Era of sleep health is now in, where we pay attention to these multiple dimensions of sleep health. And it is very important because individuals with more favorable sleep across multiple sleep metrics had lower mortality rates. So the more parameters you get it correct, the more healthier you are. And now they are coming up with different sleep scores to predict poor sleep pattern, intermediate sleep pattern, or healthy sleep pattern, and its association with health. And one very interesting finding that has come out is that in obstructive sleep apnea, we used to think it predisposes to hypertension, but every OSA patient does not develop hypertension. The missing key is OSA with severely irregular pattern of sleep. They are the ones who will develop hypertension in future. OSA, not OSA alone. So I hope I'm able to convince you that just like your smartwatch's 10,000 steps equates to good cardiovascular health, sleeping well and on time, taking care of these multiple dimensions of sleep health should, especially you focus on duration, regularity, and timing of your sleep, will provide you good health. Now, to educate people on these important concepts, we have created three important courses which cover the entire spectrum of sleep medicine, covering sleep physiology, sleep technology, and sleep medicine separately. And we have created a platform where you can learn how to analyze the data from different diagnostic devices. And there are different training opportunities available. If you log in at this link on my website, there is a webinar of what are the opportunities in the field of sleep medicine and technology in India, with all the links given. I hope with this data, and if you undergo trainings, not only you will sleep well and on sleep on time, your patients will also end up sleeping well and sleeping on time, and you will be promoting sleep as the foundation of health. Thank you so much, and you can contact me at these numbers if you have any queries regarding sleep education, sleep medicine, or your patient queries. Thank you so much. Over to the organizers, and I'm happy to take any questions.
Thank you very much, Dr. Tripat. It was very enlightening speech, and the talk was really eye-opener to many of us, as we often neglect uh, sleep, as the common saying, like "raat din duni, raat chaugni." So we think that if we work in nights, we may get better benefits, but the whole concept of sleep is slow, yet very important and often ignored. Thanks a lot for your insight, your talk, which has given us a beautiful insight. And if anyone has questions to make, kindly post it on chat so that we can take your questions. Please feel free to ask any doubts or comments if you want to give, post it on the chat so that we can take up here. See, till the no question is coming up, I have one comment and one question to make. Like, it's easy to say that take your phone off in the night, but people like us who are involved in the hostel or in the hospital setting, where we cannot ignore our phone calls. So how should what is the alternative, or what is your like suggestion on people like us?
Ma'am, the medical community, including shift workers, it's a occupational health as well. We are playing with our health. We are paying the price at the cost of our health. So it is well recognized as occupational health hazard now.
There's one Dr. Chanchal has asked that is there any she's asking about the importance of naps in the day.
See, regarding the naps, we have to look at the data from two point of view. One, naps in general population. Second, naps in special populations. I'll take it up separately, both these questions. When I come to naps in general population, there are two, uh, data is divided into two effects. One, effect on cognition and effect on cardiovascular health. All the data points out a short nap of less than an hour improves the cognition. There is no conflict in this data. Okay. But when it comes to cardiovascular health, there is conflicting data. One set of data saying naps, especially longer than 1 hour during daytime, leads to poor cardiovascular health. Another group of data says naps during daytime uh, uh, leads to good cardiovascular health. There is we are still, due to methodology issues, due to different populations, different age groups involved in these studies, we are still not able to reach a consensus whether general population should take naps during daytime or not. What has become very clear is what we advise is do not take nap during daytime after 3 p.m. because it is going to affect the homeostatic drive and you will have trouble sleeping at night. Number one. Number two, avoid naps unless it is essential for you to do your work. Like if you need to pay attention to some work and you're feeling sleepy, take a short nap, not longer than 1 hour. Take a short nap of 30 minutes to 45 minutes and not longer naps because longer naps have been shown to be detrimental. So that is a common advice we give. So in general, general population should nap only if required to do some important attention seeking work. For special populations, especially athletes, it has been very clearly shown with all the data that naps, especially between 1 p.m. to 4 p.m., it enhances their athletic performance in the evening. So, in the athletic community, naps between 1 to 4 p.m. is a very common phenomenon. You will see in all the training institutes, after lunch, the athletes, even the coaches give them the opportunity to nap before they come for training in the evening.
Another question is posed by Dr. Manjinder ma'am. How would you address the problem of sleep deprivation in students leading to poor lifestyle in teens and students?
Ma'am, it has to be at the organizational level, and it all depends how serious we are about their health. And I have seen it with my own eyes in the training institutes who are training elite athletes. Those organizations have taken sleep very seriously. And to decrease this issue of sleep deprivation, where students engage on their mobile phones at night, those elite organizations, they take away the student's phone after 9 p.m. and they give it back to them in the morning only in the name of independence, in the name of what do you say, whatever you want to say. If the organization cannot take strict actions and have plans in place, this problem cannot be tackled. If those training institutes who are training elite athletes are taking this harsh step, and students are complying with it. They have put the whole system in place where the devices stay in a safe custody, and in the morning there is a way of giving them back to the students and making sure that those elite athletes are sleeping. And I'm not talking in air. I'm not talking from the books. I have seen it with my own eyes, all this happening. Okay, so it is a problem that has to be addressed at the institutional level. It is a problem where a lot of education has to go in, not only for students but for doctors also. It requires education for the entire society that sacrificing sleep does not mean you are going to attain heights. So it is a multi-pronged problem with not a single solution at hand, and there are
Thank
some tough
you.
decisions that have to be taken.
Yeah, great, great. Thank you for the informative session, and hope our participants have gained the information and insight into how and why sleep is important, and what could be the detrimental effects if you actually do not take care of your sleep. So now it's over to Dr. Nayak for further.
Congratulations, and it's a great seminar, great deliberation from Dr. Tripat. Thank you very
Thank
much, Dr. Tripat. I have a small doubt. I should not say it as a question. Like, I would just like to know.
Just one more question has arrived in the chat.
Yeah,
So should we take that?
yeah. Just let me finish. Then we will continue with that. Okay. So I was wondering whether the like we are switching off the not switching off. We are putting the mobile or lights off, but the mobile is near my head. I'm sleeping, keeping the mobile head near my head, or my house, or my whole working place is under the Wi-Fi waves. So while sleeping, these waves are like disturbing unrecognizedly, or any information about that. Those actually lot of waves are going on nowadays. Those things, do they have any contribution to the sleep disorder or sleep health?
So to the best of my knowledge, I have not seen any data coming out on this. That different types of radiations around us during the night and its impact on the sleep. I'm not aware of any such literature.
Okay, so that could be one
At the moment,
new.
what we advise is we usually tell our patients to keep the phone out of the room.
Okay,
And some countries have gone so far, like in UK, to help students not to use their phones as alarms. Schools have distributed physical alarm clocks to the students and asked the parents to keep the phones outside the room.
okay. Okay, that's a great idea. Actually, we are disposing of other things so that the handy mobile can do those jobs. So that could be a good idea. That reintroducing the physical alarms, so that at least that near my head, near my phone ear, those waves won't be there.
Yep.
Thank you, thank you. Just one question, sir, there from Dr. Anita Barma. Snoring affects quality. Do snoring affect the sleep quality?
Of the bed partner, definitely yes. Okay. And anybody sleeping in the house, if the snoring is too loud, answer is yes. And of the patient themselves, if snoring is leading to sleep apnea, that is collapse of the airway, definitely it impacts the sleep quality.
So it should be. So your suggestion will be like, in case the patient is having snoring, reported snoring, then they should have an evaluation of sleep apnea is there or not. That
Yes.
should be done.
Yes.
I think. Thank you very much, sir. Really, we had a good time, and we are done just within 1 hour. For the participants, I would like to inform that feedback forms have been already communicated to them. So they are requested to submit their feedback forms. And I think officially we are at the verge of the end. I will request Umlata Madam to propose the vote of thanks officially.
Uh, Thank you all. Thank you all the dignitaries from SOP Central membership and the Central Executive. I want to give my gratitude towards the all the people who are working on the background of this webinar series. I thank Dr. Manjinder and her team, Dr. Nayak and the team in the AIIMS Jodhpur. Uh, I specifically thanks Dr. Tripat for this deliberation and enlightening us with the concepts which were not very familiar, or if at all we are familiar, but we were not taking them as seriously as they are. And also, not last but not the least, I thank everyone who has taken out participation in synchrony, and I would thanks everyone. And one more information I want to share is the next webinar will be on nutrition, and similar to the way right now we are doing it on the last Saturday of December, that is 28th of December, and you all are encouraged to join that as well. Thanks a lot. Thanks a lot to everyone who are the participation in synchrony or otherwise. And please ensure that you fill the feedback form to get the certifications in time. Thank you.
Thank you. Bye.
Bye. Let's- So can we stop the thing here?
Just a minute.
Okay, sir. Bye. I'm leaving the studio.